Tuesday night, the president alluded to what he euphemistically called rumors that some were concerned about his health care law. Today, Republicans continued to press their case that they are much more than just concerned. Chief Washington correspondent Jim Angle looks at both sides of the issue.
The House Budget Committee examined the fundamental assumptions of the new health care law today, and the nonpartisan chief actuary of Medicare raised troubling questions about its impact on seniors because of cuts in Medicare.
Providers might have to end their participation in Medicare, and that would have possible adverse consequences for beneficiaries' ability to access health care.
Meaning seniors would have a hard time getting a doctor. Republican Tom McClintock pressed Foster on whether the new law will actually bring down health care costs.
I would say false.
Okay.
More so than true.
The other promise, if you like your plan, you can keep it. True or false?
Not true in all cases.
Even President Obama now concedes some changes should be made in his health care law, perhaps in hopes of derailing efforts to repeal it.
If you have ideas about how to improve this law by making care better or more affordable, I am eager to work with you.
The president said we can start right now by correcting what he called a flaw in the legislation, one Republicans have been complaining about for months. It requires small businesses to file what is called a 1099 form for anyone to whom they pay more than $600 over an entire year. But now, even the president agrees it needs to go.
That has placed an unnecessary bookkeeping burden on small businesses.
In one hearing in the House today, the president's economic advisor, Austin Goolsbee, praised the law's benefits for job creation.
The Affordable Care Act can be a significant benefit to the job market by easing the burden of health care costs on small businesses.
Two small businessmen, however, said they don't get any subsidies and that the law only makes it more difficult for them to provide insurance. An owner of IHOP restaurant said it would cost him $7,000 per employee.
I estimate this to be 50% greater than my earnings. So please understand me, that's more than I can actually pay for the coverage.
And another small business owner said it would be less expensive to just drop health coverage and pay the penalties.
So I find it ironic that the part of the law that mandates me to provide insurance to my employees is really an incentive not to provide insurance to them at all.
Olivo said he wouldn't get $1 in subsidies. So at least for these small business owners, the new law is making it more difficult to provide insurance, not less. In Washington, Jim Angle, Fox News.